You're watching The Source on CNN Philippines. Our guest today, Presidential Advisor on Entrepreneurship, Joey Concepcion. Good morning, Secretary Joey.
Good morning, Ruth.
Sir, your reaction first to the declaration of MECQ for Metro Manila and nearby areas, as called for by the medical health workers. Go ahead.
Well, we respect the decision. We respect the decision of the president.
Sir, ano po kayang magiging epekto nito? Kasi yesterday I was monitoring some of the economic managers. They were against MECQ. Was it some sort of a compromise na nag-MECQ na lang po? And what can we expect yung epekto nito?
Well, I think we understand the plight of the frontliners, the medical group, and but we're also challenged with the economy. And as we enter the strong period now, August to December, this is the strongest months where we expect most of the entrepreneurs to recover. And of course, with this MECQ, we will make the best out of it. Our group is going to launch the full PCR testing before August 15, and that will help increase the visibility to determine where the infections are. No, on a part of the plan really is to move towards a granularized lockdown. But in this case, because of the number of infections rising, I understand that we will have to take a pause. No? And 2 weeks is not too long. We can manage that. But if it goes beyond 2 weeks, then it becomes a little bit more serious.
If you compare kasi to what we're having now, like GCQ going back to MECQ, some of the businesses would have to scale down again, and also there will be no public transportation. How will that affect yung economy natin na parang we were seeing it pick up na nga sana by June, ano? Picking up already.
Yes. We are on the verge of moving up. More businesses were opening up. Transportation will be increased and all of that. No, and of course, many of those who are losing money, we're looking forward to at least restarting and recovering their losses. But nevertheless, the decision of the president has been made. What we have to make use of this 2-week lockdown is to make sure that the quarantine facilities are scaled up, that testing continues to be scaled up. And our role in the private sector, as I mentioned, we will launch the full PCR testing, which will be a game changer. It will speed up testing. It will make it cheaper. And what I'm referring to are not rapid test kits.
Yes.
These are swab tests. No? These are swab tests.
When you say it will be cheaper, magkano na po kaya ngayon ang rate for the PCR test which you will be launching, and where can the public get this kind of service?
Well, the research is ongoing. The first part of the research determine, are we going to use pools of 5, 10, or 20? But if the prevalence of the infection is high, then we may have to go down to 5. If the prevalence of the infection is moderate, between 2 or 3%, then we may be able to use pools of 10. No? So that's where the research is at this point in time, and we will. Congresswoman Janet Garen is leading the private sector initiative for this effort. We are bringing 20 equipments, automatic extraction equipments that will be used for full PCR. That's supposed to arrive by the end of this week.
So wala pa hong nakaset na kung magkano yung PCR test. Kasi right now it's 4,000 or more expensive pa nga po.
On a pooled basis, if you're using pools of 5, it's about 550 pesos per person. Pools of 10, I'm told, will be about 450 pesos per person. So that means five people to a test kit. Then you have 10 people to a test kit. Of course, the lower the number of pools, like 5, it will be more expensive, but it's still much cheaper. But more than that, I think it will speed up the process and increase the capacity of swab testing, which is now, I'm told, quite tight because of the level of infection. A lot of people are doing testing.
You mentioned earlier na crucial talaga tong period of August and then going into sana the holiday season, di ba, with yung consumption going up. Can we afford, if ever, another extension of MECQ or baka possible ECQ?
We I hope not. No, and eventually we should really move towards the granularized approach. That was already the plan, to really focus on the barangays. And I was suggesting that we publish all the barangays that will be under MECQ, no, during this period. But I guess the decision was to do an MECQ for the entire NCR and a couple of other regions, no, which is fine. But moving forward, to coexist with the virus, we have to allow a granularized type of lockdown, and approach it from a data-driven approach, whereby if the getting the source from DOH as to the number of infections in each barangay, then we will know what barangays to lock down immediately. No? And I think within the 2 weeks, this gives us a bit more time to prepare for that, and our mayors will prepare for that. In fact, the private sector will fund the 16 cities and one municipality for the pooled PCR initial testing this coming August, no? And we will fund that for all these LGUs in NCR. That's a commitment already from the private sector. That's about 160,000 pooled PCR tests that will be done for this part of the research, no?
So on the part of the business sector, because some critics are saying there's no concrete plan of action presented by the government, or it's lacking. How do you view the overall approach of the government against the COVID-19 crisis?
In fairness, the government is trying to do what we can do. And the efforts really here is a convergence between the private sector and the public sector really working together. And our meeting last Tuesday was a very good meeting, which aligned all the plans and strategies and efforts of both sides. So the virus is really hard to predict. I mean, it is balancing health and the economy is really challenging. Our objective really is to save jobs, lives, and livelihoods. And we will try to do our best to save as much lives, jobs, and livelihoods, because these efforts have to be all done together. The lives of people are very important. But remember, if the jobs and livelihoods are also lost, then other problems will arise. Poverty will get worse. People will not be able to buy food, medicine, and there are other illnesses that they will have to take care of as well, which from diabetes to cancer and etc. So these are other issues that are underlying, and we have to sustain our economy, because in the end, the government also needs the tax revenues, both from the national and local level. And social remuneration is not sustainable, as the president was saying. So you have to give it to this government that, yes, there are issues, but we are thriving along, no? Because the virus is very difficult enemy to fight, no? And that's why we really need the efforts of all to unite as one, no? And I agree with the medical frontliners and all of that, we respect their efforts, and they're all admirable. But in the end, we have to work as one team.
Thank you very much to Presidential Advisor on Entrepreneurship, Joey Concepcion. And thank you for joining us here on The Source. I'm Ruth Cabal. You're watching CNN Philippines.